Hello, I'm Emma, one of the midwives at St Peter's Hospital, and I'm here to talk about the third stage of labour. So the third stage of labour is defined as when your baby has been born, and this is followed by the delivery of the placenta. So your baby has been born, we're doing some nice skin to skin with baby, and the only thing left in your uterus now, or your womb, is the placenta. The placenta is the organ that has been formed inside you from conception, and is the organ that has fed your baby for the past 9 months. It's connected to your uterus and connected through to you, and the blood vessels have carried nutrients, blood and oxygen through to your baby. It's a pretty amazing organ, and your body's created a new organ. When baby's born, it's standard practice now in the UK for babies to remain attached to the umbilical cord for as long as possible. And this is to really allow your baby to get the optimal amount of blood through to them. So the cord remains pumping while your baby is on you. It can remain pumping for several hours. Often it remains pumping for about half an hour to an hour after your baby's been born. When your baby's born, have a feel of your cord. You'll feel it doing some pulsating. In the cord, there are 2 arteries and 1 vein, as you can see demonstrated by this here. Your placenta is about the size of a dinner plate. This isn't really an accurate representation. It's rather small for a placenta. And we would recommend that you leave your baby attached to the cord while the cord pulsates for around 5 to 10 minutes, or even longer if you want. Some women will opt to have an injection to help deliver the placenta. This helps your uterus to contract down and helps to with the delivery of the placenta. It also helps to control your bleeding as well. However, if everything's going normally, your bleeding is not too heavy, you're not unwell, you have no drugs in labour, then the choice is up to you. You don't have to have this injection at all. You could have normal delivery, you could have what's known as a natural delivery of the placenta, or a physiological delivery of the placenta. During this time, you might feel some cramps, again a little bit like labour, but then be much milder, and we tend to just encourage you to focus on your baby and to enjoy this time with your baby. Skin to skin is really important in this stage. As with skin to skin, your body releases a hormone called oxytocin, and oxytocin is what's caused your uterus to contract during labour. It also causes your uterus to contract during this part and helps with the delivery of the placenta. So the higher oxytocin you can have, the more easy the delivery of your placenta will be, and obviously having baby skin to skin really helps to optimise that oxytocin release. During this time, we also recommend that you try and get baby on the breast. Not all babies will want to go on the breast at this time. Sometimes they'll just want to look around, enjoy you, and you and your partner will just want to get to know baby. But also, if the delivery of the placenta is being a little bit slow, then we tend to recommend that you try and put baby on the breast. When baby sucks at your breast, again, oxytocin is released, and that in turn also helps the uterus to contract and helps delivery of the placenta. The placenta delivery can take anything from 5 minutes up to an hour to deliver. And then we would dispose of the placenta, check it all over, make sure it's complete. Some women do opt to keep their placenta and take it home. The choice is up to yours. It is considered your organ. But we majority of the time, women are happy for us to dispose of it, but we do always give you the option. So that's the third stage of labour.